Lecture 3, Dworkin on paternalism. The cultural background of paternalism. Think for a second about how well parents treat their children. Given the difference between a parent's and child's expertise in navigating the world in a safe manner, it makes sense for the parent's decision-making to simply override the child's decision-making from time to time. A difference in wisdom justifies a difference in who gets to make the most important decisions regarding a child's life. Until somewhat recently, our doctors thought of their patients a lot like parents thought of their children. In the 1950s, it was not at all uncommon for a doctor to deliberately fail to tell his or her patient that she had cancer or some other deadly disease, so as not to needlessly upset the patient. Doctors would also routinely make decisions regarding the patient's care without having a robust discussion of the patient's options. Doctors were seen as the experts, and in the context of medicine, the general public was viewed as mere children. Nowadays, the tide has shifted, and the patient has a routinely exercised legal right to be informed of the options which pertain to her medical care and participate in the decision-making process. Hence, we have shifted from a fundamentally paternalist model of medicine to one which favors patient autonomy. Yet there still may very well be circumstances in which it's appropriate for a doctor or other healthcare workers to either override or ignore a patient's wishes. This lecture and those which we will engage next week on the topic of informed consent largely revolve around the issue of paternalism. Our first article by Gerald Dworkin concerns the concept of paternalism as it applies to the law in general. Mill's two claims. John Stuart Mill was a 19th century British philosopher who wrote some very influential works on both ethics and political philosophy. His main work in ethics was called Utilitarianism, and as its name suggests, it's a defense of act utilitarianism. His main work on political philosophy is entitled On Liberty. The main argument of this text is that citizens have a basic right to be free to choose what kind of life they want to live, and restrictions on their liberties always need to have strong justification. This is where Mill's utilitarianism comes in. Remember, a utilitarian is one who thinks that the rightness or wrongness of an action is determined by the consequences of that action for the group affected by that action. Hence, there are two possible motivations that the state could have for restricting a person's liberty. The state can restrict a person's liberty in order to prevent a citizen from harming others, or the state could restrict a person's liberty in order to prevent a citizen from harming himself or herself. This leads us to the answer, question 1a, which asks about the two theses which are present in the quote from Mill that Dworkin analyzes. Mill states, "The state is justified in limiting a person's liberty in order to prevent her from harming someone else." And B, the state is not ever justified in limiting a person's liberty in order to prevent self-inflicted harms. Regarding A, there is a famous passage in On Liberty which states that the freedom to swing my fist ends at my neighbor's nose. In other words, I can move my body as I like as long as I don't harm anyone else. Dworkin wants to argue against B. Dworkin doesn't think that the state is never justified in preventing a person from harming his or herself. Paternalism strictly defined. As philosophers are prone to do, Dworkin offers us a very precise definition of paternalism, so that the reader knows exactly what he's arguing for when he argues that there are circumstances under which the state is justified in overruling the freedom of her citizens in order to protect the person whose freedom is being limited. Dworkin defines paternalism as follows: the interference with a person's liberty of action, justified by reasons referring exclusively to the welfare, the welfare, good, happiness, needs, interests, or values of the person being coerced. Dworkin notes that examples of purely paternalist laws are hard to find, since laws often have more than one type of motivation. Paternalistic laws. Dworkin then gives a list of laws which are motivated primarily by paternalistic considerations. Our social security system requires all workers to set aside a portion of their income for retirement. Our traffic safety laws mandate the wearing of seatbelts in cars and, in most states, helmet use on motorcycles. We don't allow children to work. Gambling is often prohibited as a vice which harms poor people who engage in it. As you can see, we definitely have laws on the books outside of a healthcare setting which are justified on paternalist grounds, if they are justified at all. In the second column, Dworkin mentions that many states have laws which are set up to make it difficult for a person to refuse a blood transfusion on religious grounds. We will look at this issue closer in a minute. Premise 4 of Mill's argument against paternalism. Dworkin then turns his attention to Mill's main argument against paternalism. On the sheet which contains the reading questions, I wrote out Mill's argument and gave explanations of each premise, which I hope have made the argument very comprehensible. You should take a minute and reread the argument as I have stated it. Now, let us focus on premise 4. Premise 4 states that it's never possible to advance a person's own interests through the use of force, or, if it's possible, this can only be done by committing an evil action which is worse than letting the patient harm his or herself. Mill's main argument, in support of premise 4 is that the individual is almost always in the best position to determine what is in her own interests. Hence, Mill is committed to the view that people are highly rational and much more competent than others to reason about what is in their own best interest. How rational are we? Is Mill right about this? A little later in the article, Dworkin uses the example of someone who doesn't want to wear his seatbelt as an example of someone who's not being particularly rational in regards to acting in accord with what is in one's own interest. Wearing a seatbelt is mildly annoying car wrecks are quite common, and it's certainly in one's best interest to avoid serious injury or death. Yet, before seatbelt laws were passed, people routinely drove without wearing them. What about diet? Are people generally rational when they choose what to put into their bodies? Given our obesity epidemic and the low quality of fast food, the answer is that many people are not. If there is widespread irrationality, which affects our decision making, maybe there are a number of cases in which others are better judges than we are ourselves concerning what we should be allowed to do to our own bodies. Notice that this argument is centered on the consequences of one's decision making. If we are generally excellent decision makers regarding our own health, then presumably letting others decide for us what to do in a broad variety of cases would result in great harm. Yet, if we are demonstrably irrational as a group, then perhaps laws which force us to make good decisions we wouldn't otherwise make are justified. Let us now look at a case which involves a medical context. Forced blood transfusions. Our third question set concerns a hypothetical scenario which involves a clash between a person's freedom of religion and her physical well-being. Imagine you are a doctor who has a patient who refuses a life-saving blood transfusion on religious grounds. Should a doctor in such a position be allowed to simply overrule the patient's request to not receive the transfusion? In order to make the situation more realistic, imagine that the patient will soon be rendered unconscious and hence vulnerable to having such a transfusion performed. Question 3 asks if, in this case, the doctor has a better sense of what is in the patient's overall best interest than the patient herself. Notice that best interest is broad enough to include both a patient's physical and psychological well-being. Question 3b is not as focused on Mill's argument against paternalism. You might think that even if the doctor does have a better sense than the patient in this case of what is in the patient's best interest, that the doctor still shouldn't interfere. Perhaps you think people have the right to make bad and even fatal decisions regarding their own healthcare. This appeal to rights would be a deontological ethical consideration.